Hi, I'm Dr. Eric Fields. I am a psychologist in New York City who specializes in addiction, and I utilize a harm reduction approach, which basically means that goals can range from cutting down your substance or alcohol use to changing to a different substance that you may not have as much of a problem with to um, more moderate usage and even abstinence. So it's really an all-encompassing kind of umbrella in terms of treatment goals. Today, what I wanted to discuss is what I think is very important for people to understand who are struggling with any kind of addiction or compulsive behavior. And that is that at the heart of any addiction or compulsive behavior is a function that is serving. And, so with that being said, I have yet to ever meet anybody who has struggled with some kind of addiction or compulsive behavior who did not have an identifiable function to that addiction. In that, as we explored their addiction, inevitably, we always uncovered reasons for how this started out and why the person has now gotten to a point where they've become so reliant on it. And so this is very important, and it's a departure from the disease model. If we look at the way people view or have viewed addictions throughout history, we start with this very antiquated idea that it was some kind of moral defect, a lack of, that really there was a lack of willpower, and that there was essentially something morally wrong with the person, and this is why they did that. That, of course, was an awful way to characterize people with these kind of struggles. And so then we moved away from that, which basically placed all the blame on the person. And we went too far the other way, I think, and started saying that it was a disease that they had absolutely no control over, and that, this addiction disease causes all these issues. And, if you just take away or treat the addiction, then the person will be fine. There will be, no problems. The issue with this perspective is the large majority of us who work in the mental health field have hardly ever seen any patient that comes in for treatment where addiction is the only issue. And a lot of people would argue, well, yeah, of course, that makes sense. Like, addiction is going to cause all these other problems, financial problems, relationship problems, et cetera, et cetera, et cetera. But what most of us find is that there are issues that this person has that predates their addictive behavior. That if we go back in time, it's not that the addiction happens and then we have all these different issues, that there are already issues and then a compulsive addictive behavioral cycle eventually gets ingrained. And so this is what I really want to discuss today, that, this is just not found in practice. What is found in practice much more commonly is that the addiction is not the true cause, it's a symptom. Okay? So if you have an anxiety condition, and it's very difficult for you to sleep because of that anxiety, we don't just treat your sleeping issue. We don't look at you and say, well, you have this sleeping issue, and if we can fix the sleeping issue, you'll be fine. Because if we do fix the sleeping issue, what we're going to discover is that you're still suffering with a lot of anxiety during your, regular waking hours. And so all we've done is we've just kind of quelled a symptom of that more fundamental issue that you have, which is an anxiety disorder. So I want to go through just a few of the most common functions, and I want you to, I want to do this so that you start thinking about what function or functions does my substance use or other kind of behavioral dependency, some behavior that I'm dependent on, that I rely on, such as gambling, a sexual addiction, an online addiction, you name it. It could be anything. What is it doing for me? Like, what is it serving for me? Okay? So the most common one that we find, especially in mental health, is the self-medicating function. In other words, this is a person who has underlying psychological disorders such as anxiety or depression or even ADHD. A lot of times people with ADHD have never been diagnosed with that disorder, and they're constantly looking for extra stimulation because that is one of the hallmarks of ADHD. A lot of people look at this disorder and they say, oh, the person can't pay attention and they're distracted. Well, the reason why they can't pay attention and they're distracted is because they're understimulated, and so their mind wanders, and what their main problem really is that they're paying attention to too many things. They can't filter out anything. Every little thing they're paying attention to. This is why stimulant medication works, right? Because they're understimulated, so once they get that proper stimulation, they're not wandering as much. So if you're an untreated person with ADHD, right, and you're constantly on the go, you might be very productive at work. You're a go-getter. People will kind of attribute this type A personality to you. You're constantly on the move. You have a lot of energy. You're getting things done. We see this a lot in the professional and working and corporate spheres. These real go-getters that just tend to be burning the candles at both ends, and their bosses love them because they get so much work done, right? But the problem is that they are just stressed out and they can't keep up this pace for too long. So they need a way of kind of unwinding and shutting down the brain. And a lot of times these people will turn to substances, such as alcohol, which can be more of a sedative, or an opioid, or a benzodiazepine like Xanax. These kind of things, will help them slow down. So when we say self-medication, we're talking about self-medicating from any kind of psychological disorder. Not just an emotional disorder like anxiety and depression to help them feel better, but something like even ADHD to help them function better. So this tends to be the most common reason that, people start relying on these different kinds of substances or behavioral dependencies like gambling or what have you, is to make themselves feel better, to help them function better. My buddy's trying to get in the act over here. He's a happy dog, by the way. I don't think he has any issues with any kind of addiction. Maybe a bone addiction. So this is the most common reason, and there's a lot of other different reasons too. Sometimes it's just a personality type. There are some personalities that, maybe they don't have ADHD, but they have a tendency to get bored easily, and so they really thrive on stimulation. And so if they don't have stimulation, enough, according to their needs, then they're going to look for it elsewhere. Well, I'm bored. I don't know what to do with myself. I don't tolerate boredom as well as others, so I'm going to do a few blasts of cocaine. Or I'm going to go get drunk. Or I'm going to do some other kind of drug. So, this is another common reason that we see people. And the people with the personality types such as this, those are usually the ones where, at first, as mental health practitioners, we kind of look at them and we say, like, I don't hear any anxiety. I don't hear any depression. It doesn't sound like he has ADHD because he's able to focus and pay attention well. Like, it's not a self-medicating function. Maybe this is, one of those people who truly has a disease, an addictive disease, and that's the only reason why they do it. But lo and behold, as we explore more and more in therapy, their background and, going from childhood and into adolescence and everything like that, we eventually find that, well, they don't have like a disorder per se, but they have a certain personality that predisposes them to this. And this personality just tends to need more stimulation than other people. Other people can go and work on an assembly line doing the same task for maybe 4 hours a day and not be terribly bothered by that. And then there's other people that would just find it absolutely agonizing. And there's all other types of things too. Some people can work in a cubicle for hours and hours and hours, and other people, again, would find that kind of work just agonizing. Or can do something more mundane. Or, this kind of personality is that type that's always saying, like, I don't know how to relax. Or, when I'm on vacation, I get bored. I don't know what to do with myself. And so this could be a person that has ADHD, but it's also a person that may not have a diagnosable mental condition, but it's a certain kind of personality. So, this is the importance of this is that your addiction is not the main problem. It's not the primary issue. It's secondary. It's a symptom. It's a symptom of something else. That if you go back in history, your history, and you start to look at your childhood, before you ever touched this substance, before you ever engaged in this kind of behavior, what was going on in your life? What challenges were you having? We have a lot of people that we see that come in with PTSD that they don't realize they have PTSD, and it's based off of some kind of childhood trauma, like some kind of physical or sexual abuse. And their main purpose for using is to distract themselves and forget about this, because they don't want to think about these horrible memories. And so this helps with the denial. It's when they're not using, they're thinking about using, so that's distracting. And then when they're actually using, it puts them in a state where it's easier to not think about these things. So, when I said before that the pendulum has swung so far the other way, where, we used to blame the people with an addiction by calling them like morally defective, or there's something bad about this person. And then I said we swung too far the other way, which is that we're blaming it on a disease. It's a disease. It's not you. You might, think that sounds a little harsh. So what am I saying here? That we should blame them a little bit? Well, it's not that we should blame them a little bit. It's that we should have them recognize that they have some responsibility for this. And that's not to say that, oh, you're a bad person, you're doing this. And that's not to say that it's easy to overcome this, or that they can do it without help, or any of that. What it's saying is a positive message. And the positive message is, isn't it great that you do have some control over this? Isn't it great, and doesn't that give you hope that there's things that you can do to start beating this, to start overcoming this. That if you start realizing what functions that this behavioral dependency or addiction served for you or serves for you, that you can then begin a process of working on these primary issues, thereby reducing the reliance on this substance or behavior. And that's the positive message, that you don't have to wait for a higher power to do something. You don't have to pray it away. And listen, I'm not bashing religion or spirituality or any of that. I'm just saying that at the end of the day, this is something that you can defeat with the proper assistance. And with that being said, my name is Dr. Eric Fields. If you have any questions or you want to reach out to me to ask about my consultation services, my psychotherapy services, please feel free to do so. My web address is www.addictionpronyc.com. That's www.addictionpronyc.com. Feel free to reach out. Hope you found this helpful.